Hello everyone, I am Maria Angeline Torres, currently taking up Master Arts in Nursing, major in Administration at the University of Perpetual Health System, Dalton. I chose Hildegard Law Interpersonal Theory with regards to our theoretical perspective subject. Hildegard Law was born on September 1, 1909. She was raised in Reading, Pennsylvania, by her parents of German descent, a second daughter. At her young age, Kaplow's eagerness to go beyond traditional women's roles was precise. She considers nursing was one of the preferred choices for women during her time. In 1918, she witnessed the devastating flu epidemic that greatly influenced her understanding of the impact of illness and death on families.
In 1931, she graduated in Pottstown, Pennsylvania School of Nursing. Lau earned a bachelor's degree in interpersonal psychology in 1943 at Bennington College in Vermont. She studied psychological issues together with Erich Fromm, Frida Fromm Wichmann, and Harry Stack Sullivan at Chestnut Lodge, a private psychiatric hospital in Maryland. Lau held master's and doctoral degrees from Teachers College, Columbia University.
Hildegard Kaplaw considers nursing to be a significant, therapeutic, and interpersonal process. She defines it as a human relationship between an individual who is sick or in need of health services and a nurse specially educated to recognize and to respond to the need for help. Interpersonal competencies of nurses are key to assisting patients in the work necessary for maintaining health and well-being. The assumptions of Hildegard Kaplow's interpersonal relations theory are the following. First, the nurse and the patient can interact. Second, Kaplaw emphasized that both the patient and the nurse mature as the result of the therapeutic interaction. Third, communication and interviewing skills remain fundamental nursing tools. And last but not the least, Kaplaw believed that nurses must clearly understand themselves to promote health growth and to avoid losing the client's The theory explains the purpose of nursing is to help others identify their difficulties and that nurses should apply principles of human relations to the problem that arise at all levels of experience. Man, defined as an organism that strives in its own way to reduce tension generated by needs. The client is an individual with a self-need. Health. It is a word symbol that implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. Society or the environment. Although Kaplaw does not directly address society or the environment, she does encourage the nurse to consider the patient's culture and nurse when the patient adjusts to hospital routine. Nursing. Hildegard Kaplaw considered nursing to be a significant, therapeutic, interpersonal process. She defines it as a human relationship between an individual who is sick or in need of health services and a nurse specially educated to recognize and to respond to the need for help.
Lau described the 6 nursing roles that lead into different phases. Strange role. Lau states that when the nurse and the patient first meet, they are a stranger to one another. Therefore, the patient should be treated with respect and courtesy as nobody would expect to be treated. The nurse should not prejudge the patient or make assumptions about the patient. Resource role. The nurse provides answers to questions primarily on health information. The resource person is also in charge of relaying information to the patient about the treatment plan. Usually the questions arise from target problems. Therefore, the nurse would determine what type of response is appropriate for constructive learning. The nurse should provide straightforward answers when providing information and counseling. The teaching role. This teaching role is a role that is a combination of all roles. The PLAU determined that there are two categories, that the teaching role consists of instructional and experimental. The instructional consists of giving a wide variety of information that is given to the patients, and experimental is using the experience of the learner as a starting point to later form products of learning which the patient makes about their experiences. Counseling role. The PLAU believes that counseling has the biggest emphasis on psychiatric nursing. The counselor role helps the patient understand and remember what is going on and what is happening to them in current life situation. Also to provide guidance and encouragement to make changes. Surrogate role. The patient is responsible for putting the nurse in the surrogate role. The nurse behaviors and attitudes create a feeling zone for the patient that trigger feelings that were generated in a previous relationship. The nurse helps the patient recognize the similarities and differences between the nurse and the past relationship. Leadership role helps the patient assume maximum responsibility for meeting treatment goals in a mutually satisfying way. The nurse helps the patient meet those goals through cooperation and active participation with the nurse. The PLAU's additional roles of a nurse. First, being a technical expert. Second, a consultant. Third, health teacher. Fourth, tutor. Fifth, socializing agent. Sixth, safety agent. Seventh, manager of environment. Eighth, mediator. 9, administrator. 10, recorder, observer, and the last, researcher. The orientation phase is initiated by the nurse. This is the phase during which the nurse and the patient become acquainted and set the tone for their relationship, which will be ultimately patient-centered. During this stage, it is important that the professional relationship is established as opposed to a social relationship. This includes clarifying that the patient is the center of the relationship and that all interactions are and will be centered around helping the patient. This phase is usually progressed through during a highly impressionable phase in the nurse-client relationship, because the orientation phase occurs shortly after admission to a hospital when the client is becoming accustomed to a new environment and new people. The nurse begins to know the patient as a unique individual, and the patient should sense that the nurse is genuinely interested in them. Trust begins to develop, and the client begins to understand the role and the nurse role and the parameters and boundaries of their relationship. Identification phase. The client begins to identify problems to be worked on within a relationship. The goal of the nurse is to help the patient to recognize her own independent participation role and promote responsibility for self. Exploitation phase or working phase. During this phase, the nurse and the patient work to achieve the patient's full potential and meet their goals for their relationship. A sign that the transition from the orientation phase to the working phase has been made is if the patient can approach the nurse as a resource instead of feeling a social obligation to the nurse. The client fully trusts the nurse and makes full use of the nurse services and professional abilities. The nurse and the patient work towards discharge and termination goal. Resolution phase, termination phase. The termination phase of the nurse-client relationship occurs after the current goals for the client have been met. The nurse and the client summarize and end the relationship. One of the key aspects of a nurse-client relationship as opposed to a social relationship is that it is temporary and often of short duration. In a more long-term relationship, termination can commonly occur when a patient is discharged from a hospital setting or a patient dies. In more short-term relationships such as client visit, an emergency room visit, or health bus vaccination visit, the termination occurs when the patient lives and the relationship is usually less complex. However, in most situations, the relationship should terminate once the client has established increased self-reliance to deal with their own problems.